us from. So kindly don't forget to share this video with your loved ones and friends. I'm Dr. OPJ and I'm so excited today. So today we're going to talk about very important stuff today. So we are still with the heart failure episode, and today is episode 4. Welcome everyone. I'm so excited. So today we're going to talk about heart failure. There's a criteria I think is very interesting you need to know that doctors usually use to diagnose heart failure. But then a quick disclaimer, okay? I just want to say that this criteria does not also negate the fact that we need to do some investigations for when to diagnose someone with heart failure, okay? So that's one of the things you need to put in your mind. Okay, hello, hi. Yeah, thank you so much for joining. Kes Talking Cats. Oh wow, I love the name. All right, thank you so much for joining. So today I'm still continuing the series from what we are doing. I'm going to mention a certain criteria that we use to diagnose heart failure in people who come to the hospital. So that's what we're going to look at. So I want you to drop in the comment section where you're actually watching from. Let me give you some shout outs, you know. Yeah. So today we are going to learn a lot as usual. So don't forget, okay, Earth will soon be part of the what Viltment Empire. Ooh. Okay, I love this one too as well. That's from Hepsin Epic Dad. Oh, that's nice. That's nice. That's nice. All right, nice meeting you, my good friend, Hepsin Epic Dad. Great. So I'm going to talk something about heart failure. Okay, there's a criteria we need to know about, which is called the Fragham's diagnostic criteria. Okay, it's used to diagnose heart failure. So yesterday, I remember I said that for we to say that someone is having heart failure, there should be, oh, okay, hello, Marvina, Hassini, you're saying hi. Oh, hi, that's great. I have a new friend, Marvina. Thank you for joining. I really appreciate it. Marvina, I've saved your name. Okay, guess talking cats who said hello. Hello, I really appreciate you for joining this live. I'm fine, I'm fine. I'm fine so much and doing great, and I hope you're also doing great yourself. My new friend. Yeah, yeah. So I'm fine. So there's this I also want to talk about. I remember there was a patient. Okay, if it's good, like if good, like I did not get that though, but I'm sure probably you're saying it's good. You know, yeah, yeah. My good friend. So I now have two new friends, and they are my good friend. Are you saved and born again? Yes, I am. I am saved and born again. I'm a believer in Jesus. Yeah, yeah. Thank you so much for asking about my salvation as well. David, young blood. I really appreciate your question. So, yeah, thank you. So, as I was saying, I was talking about heart failures. So, there are some signs and symptoms that usually people present with, and for you to know that they are actually having heart failure. So, yesterday I said that, oh, you can even drop your comments, anything you would like to ask and know. I'll be glad to, you know, let's have some time together since you are now my new friend. Ah, my favorite cartoon. Ah, I don't usually watch cartoons, so I don't have a favorite. But then I think there's a favorite one when I was growing up. Um, uh, Scooby-Doo. Yeah, Scooby-Doo, Scooby-Doo. Scooby-Doo, exactly. I think that's one of my favorite. What do you think about Islam Muslims trying to take over America preaching Islam? Okay, so Davy Young Blood. I'm not in America, and I don't really know how the system in America is. Okay. Um yeah. Scooby Doo is a good Ted and also very true, very true. So as I was saying, I don't really know how America is, and so I can't say much about that. Okay. Yeah, my good friend David Youngblood. Okay. Yeah. Yeah, Scooby Doo. Yeah. I think that's one of the things that kept my mental health growing up. Watching Scooby Doo and I because it bring back memories, and you know, memories are also part of your healing. As an individual, sometimes when you reflect on some of these memories, they can get you. You take some healing from those past memories. Okay, I'm telling the truth. Who is this, please? Where are you from? Okay, so I'm from Ghana. Yeah, I'm from Ghana. Ghana. And I am telling the truth. Okay, I don't know the truth. Please, Kidi, is it Kidi Chamhan? I think I got the name right. I don't know what truth you're talking about though, but I know the truth about health is one of the important aspects that we need to preach about to people, okay? Especially when I believe that. Oh, okay, you're from Algeria. Oh, nice meeting you, my good friend. I think I'm having new friends here. I really love that. I've seen Cares Talking Cats. Cares Talking Cat. Do you enjoy movies, cartoons as well? And what's your favorite cartoon? Yeah. And then Nina Badaj said it's from Algeria. Okay, Cares Talking Cat says, what board game do you like? I don't. Board game. Hmm. I think this question is. I don't really get that one. Okay, so Nina Badaj is asking, are you a Muslim? Oh no, I'm not a Muslim. I'm not a Muslim. But I love my Muslim friends as well. Yeah. I have close Muslim friends, but I'm not a Muslim. Yeah. Mina Badaj, thank you for asking. Okay, so as I was saying, there is something called the Framingham criteria for diagnosing heart failure, and we have grouped them into major criteria and minor criteria. This is just a simple way to know whether the person you are dealing with is actually having heart failure. But before I move to that, or you can ask any of your questions as I discuss. I'll be able to chip in the answers you are asking in the comment section. Okay, so feel free to always ask me. Okay, since you are now my new friend, I will ask your questions. I'll answer your questions. Cat talking cat. Okay, do you speak Arabic? No, I don't speak Arabic, but I speak French, and it's not 100%. Okay, it's a bit of, maybe let's say 60% French, and I'm fluent in English, yeah, 100%. But for Arabic, I don't speak it, and I can't read Arabic. Yeah. Yeah, so okay, so Cat Talking Cat said hi again. Okay, that's great. Okay. Okay, you can keep your questions coming. Nina Badash, Algeria. Hi, is Algeria. Okay, you speak French. That's great. Bonjour, bonsoir, bon après-midi. All right. Okay. This one says, what was your childhood game? Okay, my childhood game. I think I love. I don't know if, in Ghana, we have a game that's called Pampana. I know you don't know that one. I know you don't know that one, but It's called Pampana, and it's one of my favorite games. Let me just give you a picture of how the game is. The game is so you take some like group of children to be playing. You take some something, let's say something very valuable, and you hide it, and then you make your colleagues go and search for it where it's located. And once they're able to find it, or once you're able to find it, you can shout Pampana. So that's basically what it means. It's a very interesting game. It's like hide and seek. You hide something and you will try to seek it out. So I don't know. You don't know the game, you know, but I enjoy that game. Okay, so you are so dull in English. Okay, that's what you think. Dembula. Okay, you said I'm so dull in English. Probably English is not my mother tongue, so. Hello, sir. I'm Nina Baduma. I'm 12 years old. All right, Nina, nice meeting you. I really appreciate you joining the live. Okay. Yeah, so the heart failure, the criteria, as I said, there are some symptoms that you begin to notice from someone. Um, um, that is, difficulty breathing. So if the person has been having difficulty breathing for a very long time, okay, Care's talking cat. Care's talking cat, do you have a favorite cat? Do you have a favorite cat, or do you have cats? Do you have a pet? And I'm sure probably a cat is your pet. Or what do you think? Okay, so Mina is also saying you're not understanding. Okay, so Mina, I'm talking about heart failure. And I'm saying that our hearts, okay, can actually fail. Like the way when you go to school and then we can get 10 over 10 or 100%, our heart can actually work at 100%. And then, as it's working at 100%, there can be some factors or some things that can happen that the heart now will not be working at 100%, but then start working at, let's say, as low as 30%, and that is what we call heart failure. It can work as low as 20% and that. Okay, so Nina is saying, my English is not good. Okay, my English or your English? I want the clarity on that. Oh, yeah. Then cat's talking cat is also saying, I have a dog and a cat. Oh, wow. So what's the name of them? The name of the cats and the dog. And I know you will take good care of them, right? So the name of the cat and the dog. All right. So difficulty breathing is one of the signs you see in someone with heart failure. The next second sign or symptom someone with heart failure presents with is chest pain. Okay, so sometimes, not usually, but sometimes. Okay, the dog name is Chopper. Okay, and I'm sure the cat name will be okay. Okay, Nina Badash, you're in Africa. Oh, okay, I love Africa. I love Africa. I love Africa because I'm from Ghana, and I love Ghana. I love Africa. In fact, I love everyone, and I always love to make new friends in almost all parts of the country or part of the world. Yeah. Okay, my cat's name is Luna. Ooh, Luna. That's Luna. That's like moon, right? Luna means moon. I'm sure I'm right on that, right? Yeah. Lunar eclipse, solar eclipse, lunar eclipse. So I know Luna, maybe moon. Okay, so another symptom of heart failure someone will have will be I got it right. So another symptom someone will have will be um, palpitation. Okay, palpitation is when you are feeling your heart beating. Okay, so ideally when you are sitting down like this, as we are chatting and we are talking, you are not conscious of your heart beating or heart working. All right. However, people with heart failure, they can feel their heart beating, and sometimes very loud. They can hear it. Okay, African DNA, Dembula. Yeah, I have an African DNA. Yeah, yeah. All right, Kes, talking cat. Do you have your cat or dog with you? Are they close to you at the moment? Or Luna? Luna is around, oh? Okay. Dumbella, I'm meeting you for the first time. Thank you so much, and I really appreciate you joining the live. All right, great. So let's continue. So, as I was saying, palpitation. So the heart is actually beating to compensate trying to compensate the demand of the body that needs oxygen. Okay. All right. Yeah, but my cat got abandoned by my mom. Ooh, sorry about that. Sorry about that. Oh, okay. So you're also asking, Dumbula, what's my body count? Ooh, I don't have a body count anyway. Yeah. Anyway, so let's go back to what I was talking about, okay? Okay, my dog is fine. Okay, that's fine. That's fine. All right. So I was talking about um, palpitation. That's so I've mentioned difficulty breathing. I've mentioned palpitation. Another sign you see is, oh, you can ask me all your questions. Okay, I'll be glad to answer them. Okay, I'll be glad to answer all your questions. But then the most important is also to follow the discussion. So as we are having a discussion, then you're asking your questions and I'll be giving my answers. Okay, the answers I know, that's what I give. The ones I don't know and I don't have an idea about, I will tell you I don't have an idea about. It's okay, my new friends. I think I'm really enjoying cats talking cats, you know. Yeah. Mina, where are you? Mina? Mina Badach. You're not commenting again. Okay, said I'm a member of MS13. I don't know what MS13 means or MS13. Don't know what that is though. But then if Ben Bula, you can tell me what it is. I'll be glad to know what exactly it is because I'm always open to learning. I'm always open to know more. And I'm always, there are a lot of things I personally do not know. So, okay, my dog is a poodle. Anyway, so the fourth sign is they easily get tired. So people with heart failure easily get tired. So one of the things you begin to know that once they walk short distance, they are tired. With every little thing they do, they are tired. And the reason is simple, because the muscles of the body needs oxygen to do all the activities of the body. So for you to jump, for you to dance, for you to sing. Okay, it says I should go and Google it. Okay, so I'll do that after the live. So let me write it down. I love this. I have a pen here and my book. So let me write it down. I'll do that after the live. MS13. Okay, so Dembula said I should go and Google it, so I'm going to Google it. All right, thank you so much, Dembula. Okay, so I've mentioned that. So someone should kindly tell me just one of the symptoms of someone having heart failure. Just comment in the comment section, just one. All right, just one, and I know that at least you are following me, even though we are discussing. Yeah, we have gotten one thing that I mentioned. People living with heart failure may have just one. Kes talking cats, can you help me? Or Dembula. Dembula, can you help me? Oh, my good friends. You see, you asked me all your questions and I was answering, but then I asked this, you don't want to answer. Kes talking cats. So my question is, okay, do you know? Okay, do you know about Outfit 7? Who made Talking Tom? Woo. Hey, I know of Talking Tom, but I don't know, you know, uh, yeah, who made the Talking Tom? I don't know of that. I don't know of that. Probably I'll also find out. Okay. Yeah, but if you can share with me, I'm glad to know about it. Yeah, yeah. Okay. So, so, so I was talking about the Fragingham's criteria. So the major criteria you use to diagnose someone with heart failure is when one, their heart is enlarged. So how do you know that their heart is enlarged? When you do a chest x-ray and you see from the chest x-ray that the person's heart is enlarged, that is a major criteria. Okay, it was made in 2010 between. Oh, okay, thank you so much. I've learned something new. All right. Care stocking card. Thank you. I really appreciate it. Okay. Okay, so you are my top fan. Ooh, I love that. Okay. Okay, I really appreciate. I really appreciate it. Okay. Yeah, so you do a chest x-ray and you see that the heart is enlarged. Also, with the major criteria, there's one of the things you know. If you remember the last time in our life, I talked about what we call the paroxysmal nocturnal dyspnea. I said that it's when someone finds it difficult to breathe, especially when during the night he wakes up and then he finds it very difficult to breathe. Oh, please don't forget to let's talk, okay? You can ask me anything and I'm ready to answer them. Dembula, you're not there again. Ask me your question. Dembula and Kes talking cats. Okay, Mina is no longer asking her questions or his questions again. And also, um, yeah, it's only Mina. Kes talking cat has been so amazing, my good friend. And then Davy Youngblood also did not comment again. I don't know where you are. Please share this live to someone. All right, kindly do me a favor by sharing this live. Let's make new friends. Yeah, and Hexen Pick Dad also said something. It will soon be part of. You can ask me all your questions. I am Dr. OPJ. That's my name, Dr. OPJ. Um, I'm into health, and I talk everything health. However, I'm also open to answer every question around, and also, okay, what is your favorite planet in the solar system? Okay, so there is a song I know. The song is that helps me remember the planets. Okay, my very eyes may just see under 9 planets. So my favorite planet in the solar system is Earth. It's Earth. Yeah, because let me give you a reason. Kes talking cat. The reason is simple. Because I've not been in any part of the planets in the solar system, and it's only Earth that I've had the experience to be with it, grown in it, have it benefit of the plant it produced, the water and every stuff. I think my favorite should be the Earth because it also supports life. All our other planets don't support life. I stand to be corrected, but it's only Earth that supports life, and so that would be my favorite planet. But in terms of size, I think Jupiter, it's in terms of size, would be my favorite. But in terms of supporting life, in terms of how, in terms of supporting life and plants and stuff, I'll go for Earth. Yeah. What about you, guest talking cat? Okay. So, so there are also some things you are supposed to do to prevent heart failure. Okay. Um, you need to exercise regularly. Exercise regularly. um, you need to exercise like three to four times within a week for about 30 minutes within a week, and that helps you, okay, to prevent you from getting um, heart failure. Another thing you need to also know. Okay, hello, bro, Mina. Okay, Mina is back. Mina is back. Mina, I was asking of you, and hello as well. Nice meeting you. So I have new friends. I can remember the name. Kes Talking Cat, Mina Badaj, and Dembula, you're not commenting again. I don't know why, though, but Dembula is not commenting. But Kes Talking Cat is one of my friends who's commenting, asking me, kindly ask me all your questions, okay? I'm ready to know a lot of people, make new friends. We all learn together. Yeah. Yeah. Okay, bro. See, Asta curfew. I don't know what that means, but I'm sure it's an Arabic stuff. So help me give me the meaning of what that means, and I'll say that in English. Okay, I'm sure it's an Arabic, but tell me whether it's an Arabic or maybe probably Nina. Okay, so I should say it. I don't know the words. Like, I don't know. Asta. I don't know. I don't know what it means. Like, I can't. You see, there are some words that um, the pronunciation may be different. The way you pronounce it, I may pronounce it and maybe different. Okay, so I want to try it and see. Astag furul something. I don't know if I got it right. Okay, I've said it. I've said it. So what does it mean? Abstag furul. Yes, I need to. I need to learn how to say it. I mean, I need to learn how to say it. That's why I want to know whether it's Arabic. If it's Arabic, I'll be glad to learn, you know. Okay. Just tell me what it means. Once I know what it means, I'll be glad to, you know. Okay. So one of the things you also need to do to prevent heart failure, say mahaba. Ma, ma, mahaba. What does that mean? Okay. So, um, okay, so that means thank you, right? Is it in Arabic? Is it in Arabic? Cat's talking cat. That means Thanksgiving. Okay, thank you. Okay, so what language is that? Is it in Algeria's language or marhaba? Marhaba. Mina marhaba. Yes, I would like to know what language is that, so I can write it down. Let me write it down. Marhaba. Okay, so before that, oh, okay, marhaba is hello in Arabic. Ooh, I never knew. I never knew. All right, so marhaba. Anyway, so to add up to what I was also talking about, another way to prevent heart failure is avoiding smoking and alcohol intake. Okay, it is known with statistics that alcohol and smoking intake are one of the leading cause of heart failure, and I mean they are risk factors for heart failures. and I talked about. Hey, wait, Mina, are you a Ronaldo fan or Messi fan? Okay, so sweet. All right. So Mahaba. Okay. All right. All right. So okay. So I asked the question, and none of you have still answered my question. Mention one. Oh, I see. Mina. Yeah. Okay, that's nice. That's nice. I'm a Messi fan, anyways. The greatest of all time. Okay, so I asked the question, okay, before I end the live, okay, I want to know, um, just mention one warning sign of someone with heart failure. I want to know whether you followed. Tell me what you learned, or what I said. Oh, greatest of all time. It's not, it's not, it's not Cristiano. Okay, so do you have any pets? No, I don't have pets. I don't have pets. Um, I don't have pets. Um, I don't know, but I think I should have, but I don't have. Yeah, I think. But then if I will have a pet, one of my pets should be. I think my pet should be. The reason why I don't have pets could be that I, I'm not ready to. They are excretors. I mean, I can't. I just can't handle that. So I feel like it's going to be a burdensome to me. But I just love pets, so probably to be a dog or a cat. Yeah. But the excrete, that's where the problem comes. So I don't actually have it. Okay, so for my age, I'm not going to say it online, but then I'm still in my 20s. I'm still in my 20s. Yeah. Do you know what is my dream? No, 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 I don't know. I don't know what is your dream, but you can share it with me. Or probably I can get inspiration from that. Yeah. All right. So, oh, no one has said anything about the symptoms of heart failure I mentioned. Oh, my good friends, you're not really helping me on that. I just asked one. You see, you asked me all questions, and I've answered you all of you. But okay, yeah, to be a player of football. Oh, thumbs up, thumbs up, thumbs up. Mina Badash, Mina Badash, Mina Badash. That's good. That's good. That's good. So please, who is answering my question? Mina Badash or Kes talking cat? I said that mention one heart failure signs or symptoms. Someone with heart failure. What are some of the symptoms the person will have? Just one. Mm-hmm. Oh, Mina Badaj. Mm. Oh, no one is answering. So I mentioned a lot. So mention just one will be fine. Hello. Yes, I will. Yeah, I know about. I don't know about it, but I want you to answer my question. Just one, so I can have. Once someone is able to answer that one question for me, I'll be able to talk. We can talk more. But no one has answered my question. I'm asking that what are some of the signs of someone with heart failure? Okay, just mention. I've mentioned quite a number of them. I mentioned difficulty breathing. I mentioned chest pain. I mentioned um, 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 you know, palpitation. then I also mentioned the risk factors. So just mention anything, whether smoking, alcohol, anything. Okay. Once you mention that, we can still talk. Mm-hmm. Yeah, and I want to know about the incident there. So please answer my question, and I'll love to know about the Talking Tom incident, 1999 incident. I love to know new things, but then answer my question for me, okay? Mina Badaj, you said I want standing English. Okay, did they have a standing English? I don't know of that though. But the English I know is English, not standing. Or you want to understand English? Oh, okay. I'm sure maybe that's what you want to mean. Yeah. Hello, my good friends. Yeah, you want to understand English. Yeah, that's nice. That's nice. Once I'm speaking English and you understand it, that is a good start. I don't know what's your level of English, how you speak the English, but then, yeah, yeah. It's a good start for me to talk and you were able to reply in text. That's a very good stuff. Okay. Oh, but then no one is answering my question. Oh, I'm sad. Do you know BFDI? Oh, Kesson talk. You did not answer my question. My question is heart failure. Tell me what you know about something I just mentioned. Some of the things I mentioned. Yeah, I mentioned about in our discussion. I was talking about heart failure, and I said that. Okay. So okay, probably someone should mention some of the, the risk factor for heart failure. I mentioned some things. Okay, if you know, mention them for me. Oh, no, he's answering. Okay, then share the videos to your loved ones and friends so we can have a very interactive section. Okay, so share the videos to your loved ones so we can have more people and you can ask their questions and I'll answer. Oh, talk, you got to leave. Oh, but then you don't answer the question. Okay, then see you same time tomorrow. Don't forget to subscribe to the channel so you can always get updated anytime I'm going on live. Okay, so my name is Dr. OPJ and I'm so happy you joined, my good friend. I want to see you same time tomorrow so we have a wonderful time. You can ask me all your questions. Bye. Thank you so much for joining. Okay, so my good friends, thank you all so much for joining. I really appreciate you joining today. Hopefully, God willing, same time we go on live tomorrow to talk more about heart failure. So, but then at the same time, you can ask me all your questions. My name is Dr. OPJ Hub, and I'm on this channel, OPJ Hub, which is a health channel where we talk everything health. So don't forget to subscribe to this channel to always get updated anytime we post our amazing content. And I know you have learned something today. I've also learned something today from you guys, the questions you asked. But Kes Talking Cat did not tell me about the Talking Tom incident in 1999. I hope tomorrow he will share that with me. And Mina Badaj, I really appreciate you joining me. I sincerely say thank you. And I want to say the Arabic word. I'm looking for the Arabic word. Ma ma mahaba. 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 Thank you so much, Mina, for teaching me Arabic. And he also taught me our stuff, astaf, astafrula, astafrula. Thank you so much. Okay, then until then, don't forget to subscribe to this channel, okay? See you same time tomorrow, my good friends. Then, bye. Oh, doctor. Yeah, we closed. We closed.